Welcome to DDUH Library, How to use MeSH. MeSH stands for Medical Subject Headings. It is a controlled subject vocabulary that is used to index literature in medical databases such as Medline and PubMed. It can be used for searching and finding medical literature. MeSH terms are similar to standard vocabulary that use a single term for one idea. Let's take a common health issue, caries. We could call it also dental caries, dental cavity, tooth decay, or caries lesions. If we were to write an article about it, we could use either one of those words. We are unlikely to use all of them. MeSH is a way to describe articles with a standardized vocabulary that always uses the same terminology for the same concept. So what is the MeSH for caries? The only way we can find out which is the correct term is to be looking up the MeSH database. To find the database, go to PubMed and right-click on the MeSH database link. Open in a new tab. We are going to start by looking for caries. A number of different options come up. Dental caries is the MeSH term used for caries. You may need to try a few alternatives if you do not find a term the first time. There will also be specific concepts that do not have MeSH terms. Looking at the screen, the MeSH is in bold at the top. An explanation of the term is below. It is always a good idea to read this to make sure this is actually the right one. Subheadings that can be applied to this heading are below. The entry terms are all the terms dental caries is used instead of, or they are all the unused terms. We also have see also terms. These are related terms that may also be relevant. At the bottom is the subject tree. Above dental caries is a more general topic, in this case tooth demineralization, and below are more specific topics, root caries. If we click on tooth demineralization and scroll to the subject tree, we see the more specific headings for it, dental caries and tooth erosion. How do you use MeSH terms in a search? Once you have found the correct MeSH term you want to include in a PubMed search in the MeSH database, click on Add to Search Builder. This can then either be copied into a search you are building in a text document or click on Search PubMed. In Medline Orbit, using the term finder can be used to identify MeSH terms. Always combine a MeSH term search with other relevant keywords. For example, if I want to find all articles on dental caries in PubMed, something like this. In addition to the dental caries MeSH, we add or caries, or tooth decay, or dental cavities, or caries lesion, or caries lesion. Use double quotes for phrases. To see the difference between the two searches, go to Advanced Search. In the search history, you can see the difference in results numbers. Adding alternative terms increases results and ensures that your search is complete. Repeat for any other aspect of your topic. For example, prevention, and then combine the relevant lines with and. What does this look like in PubMed? I'm going to look at the first article. Scrolling to the bottom of a page in an article record, I can see the MeSH terms assigned to this article. The aim is to have all relevant MeSH terms listed. The terms with a star indicate major topics of the article. The terms with a slash indicate the specific subheadings that apply to this article. Not all PubMed articles have MeSH terms. That's one of the reasons why it is important to always also include keywords in search terms. Looking at relevant articles in PubMed is a good alternative way to identify relevant MeSH terms. For more information, check out our other library how-to videos or ask a member of staff for help. Bye!